During basketball, football, even other exercise, several injuries take place. And most people that play basketball, football, they are being educated about the injuries that are going to take place, the risk of it happening, so they are aware of it. Same way things like this happen with this exercise. That is the same way some injuries happen during sex. And it is important for you to have idea about the likelihood of its occurrence and know what to do next. Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with a difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you injuries that are likely going to occur during sexual intercourse. So as usual, you stay informed and not misinformed. But before we go into details in today's class, if you are new on our YouTube channel and these are content you are interested in, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Miss Mary saying thank you. Let's go there. Welcome back. Like I earlier said, today I'm going to be sharing with you 5 injuries that are likely going to take place with sex, and I'm also going to be giving you some bonus points, some addition, so you can take home. So the first one I have to share with you, let's dive into the point, is penile fracture. Is this shocking? Yes, the penis can actually break. I know you are thinking, does the penis has a bone? It doesn't have a bone like our hands, our fingers, our legs. But yes, it doesn't have a bone, but it can break. It is not the fracture you think on a normal sex. It is a different fracture entirely. There are some sex styles that can predispose the penis to penile fracture. I made a video on penile fracture and all the things you need to know about penile fracture, from the causes, from the sex styles that are likely going to cause it. So if you want to stay informed, you can watch the video on the description box. That's going to help you have an idea of what penile fracture is all about. So the second injury that is likely going to take place is vaginal tear or anal tear as a result of sex. This could be as a result of rough sex, like rough sex. You understand what I mean? So outside rough sex, what can cause vaginal tear or anal tear could be irritations or lack of lubrications down there. So if the vagina is not properly lubricated, is not wet enough, that can lead to irritation, and that can lead to vaginal tear. So I think you should take note of it. If you know you are extremely dry down there, it's advisable you get some lubricant that is good for you, that to help like increase the wetness around that area and encourage good to and fro of the penis in and out of the vagina. So then that takes us to the third injury that is likely going to happen, and that is allergic reactions. Yes, allergic reactions are likely going to happen, and sometimes allergic reactions are very severe if not attended to immediately. Some people are allergic to latex, for those that use latex condom. Some people are allergic to substances that might be in some lubricants. Some people are allergic to things that they insert into the vagina without knowing. Some people are allergic to different things. So allergic reactions are likely going to take place. So you as an individual, you have to be aware of your allergies and what you are allergic to, and what you're allergic to avoid some things that are likely going to harmful to you. Then the fourth point I have to share with you is pulled muscles. I heard of people say, oh, I have muscle pull during sexual intercourse. Like, it can be extremely painful, especially for the men, depending on what they are riding, who is riding. So muscle pull can take place during sexual intercourse. Back pain, lower back pain generally can take place during sexual intercourse. So if you are a man, you are a woman, and you are having some orthopedic issues, it's advisable you speak with your doctor for proper examination and information that is specific to you. Then the fifth point I have to share with you, which could be shocking, is foreign objects can get stuck in the vagina. Foreign objects can get stuck in the genital area. I know it sounds surprising. When I say foreign simply means what ought not to be there. So for those that use some sex toys, that use some fruits like cucumber, carrot down there, these things can get stuck in your vagina, and that can result in medical emergencies that needs to be tackled as soon as possible. So stay informed and don't feel nothing is going to get stuck. You've seen the penis even getting stuck in the vagina, not just sex toys, fruits, or vegetables. Then another thing is rough sex can actually be painful. It can be extremely painful. This is the bonus point I am here to share with you. It can be painful, so you just have to, like, there should be a communication between both parties. There should be an understanding between both parties. Consent should be made on what should be done and what ought to be done or what not ought to be done during the whole process of having sex. Then another is STIs. As a bonus point, like I earlier said, is not injuries, but sexually transmitted infection can take place after sexual intercourse, can be transmitted from your partner. So that is why it is important to also make sure that before sex, both parties know their status, to know if any of the individual have sexually transmitted infection. Then another bonus point I have to share with you is active key to exhaustion. So if you are having underlying conditions, you need to be careful, especially if you are having some lungs and heart condition. You have to be extremely careful with sexual intercourse, because cardiac arrest can take place, heart failure can take place, a lot of things can go wrong, because sexual intercourse is like an exercise. You're exercising your body, you are doing a lot. Exhaustion is going to take place. So if you're having heart issues, there's no blood flow, no oxygen flow, you're having lung issues, oxygen flow is not there, blood flow is not going on properly, that might lead to problems that you don't want it to happen. So it's advisable you speak with your doctor and get informed if you're having any underlying condition. So these are the injuries I have to share with you. Before I want to go, I believe sex is something that requires communication between both parties, honesty between both parties. You have to be honest with your partner about what you are, who you are, what has happened to you, things that you like, things that you don't like during sexual intercourse. You have to communicate. You get? So it's not something that you just dive into, do what you like to at the detriment of your partner. Do what you like at the detriment of your other partner. Because I've seen cases where men with STIs, they keep it to themselves and get their wife infected. And also women with, I've seen a woman with HIV and AIDS who is taking medication but refused to tell her husband. So things like that, for you to have sex with the person, you should be able to like build that trust with the person and tell the person whatsoever you are passing through. So the other partner tends to be conscious of it, tends to treat themselves, and tend to be aware of what is happening. Please and please, while having this 5 minutes, 10 minutes, 20 minutes enjoyment, our future is also very, very important. So thank you very much for staying tuned. Thank you very much for watching this video. Please don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mary saying thank you. Bye, and see you in our next video.